look for signs of life in the patient. Signs of life are movements, twitching, attempts at respiration. If there are no signs of life, this is the point at which you call for an ambulance. As the patient has no pulse, we need to do external cardiac massage. To do that, we find the two landmarks to establish the center line of the patient. First landmark is the sternal notch, the other landmark is the xiphisternum. If you place your ring finger on the xiphisternum, then 2 fingers away from it, place your palm, and it's just that portion of the palm which is in contact with the patient. Lock your fingers together. Make sure you're in the right position and commence compression. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15. Back to the mouth, 2 breaths. And back to the chest, and 15 beats again, and 2 and 3 and 4 and 5 and 6, etc. A better way to ventilate a patient would be to use a resuscitator. With a resuscitator, we can give the patient 100% oxygen. To use it, place the resuscitator over the patient's mouth, lock your fingers underneath the chin, open the airway, and squeeze gently into the bag. This is a superior way of ventilating the patient. We've just carried out CPR, which is cardiopulmonary resuscitation. It's commonly known as the ABC of basic life support. The A for airway, B for breathing, and C for circulation. If the patient's breathing and has a pulse, then we would need to put the patient in the recovery position. To do that in the dental chair would be dangerous. So a good compromise would be to place the patient in the flat or Trendelenburg position and then turn the head towards the suction and place something bulky like a rolled up towel or a coat underneath the right shoulder. In this way, the larynx is higher than the mouth, and therefore anything dribbling out of the mouth will be dribbled out and not be re-inhaled.
Okay, if you straighten the legs.
Okay.
It is important that the practice is geared up to cope with an emergency. It's recommended that every practice trains from time to time with a simulated emergency scenario. Most practices would be expected to undertake this training in basic life support at least once a year. In addition to training, every practice is expected to carry a certain basic amount of equipment. You need to work out a protocol so that you'd know exactly who would call for an ambulance, who would initiate the treatment, and who would initiate basic life support. Every member of the practice team should have rehearsed it as a team and be familiar with how to do it.
1, 2, 3. Okay.
Great.
Got that?
Yeah,
Somebody
so
else
come
wanna
back
go?
to me now.
Okay.
Thanks.
Okay, first of all, find the sternum. Okay, go up a couple of fingers. That's fine.